Okay, let's talk about the pathophysiology of sickle cell. And here we want to explain how the signs and symptoms come, how these patients what happens to the body for this patient to start complaining of the presenting signs and symptoms. We said in the beginning that the sickle cells form what we call a sickle shape, and they are not flexible. They cannot move through smaller vessels. Therefore, as they move to smaller vessels, they obstruct the flow of blood. So at the end of the day, they break down prematurely. And as they break down, this breaking down of this sickle cell leads to anemia, because the hemoglobin, which is a receptor for oxygen, breaks down. And this person is going to have hemolysis. And when the red blood cells break down by hemolysis, a process of hemolysis, the person will look anemic even without having bled physically. So this anemia will lead to shortness of breath, fatigue, and delayed growth and development, especially in children. When we talk of shortness of breath, meaning that this person, when the cells break down, or when they become sickled and break down, it means we have less oxygen receptors. Therefore, this person will not have enough oxygen levels. And due to that, this person will try to breathe faster in order to compensate for the gap of oxygen. When I talk of fatigue, just because a person is having anemia and lack of oxygen, of course this person will be fatigued. And in children, it will lead to delayed growth and development. So the rapid breakdown of the red blood cell may also cause yellowing of the eyes and skins, which are signs of jaundice. What does it mean? That the red blood cells, they will break down, and this is iron. They will continue to break down, and as they break down, its byproduct, which is bilirubin, will be accumulated in the blood. And at this time, this high accumulation of bilirubin may fail to be excreted through the kidney, through the liver and then the kidney. It means the skin will take on the excretory process, or the excretory function, and then the yellow coloring will appear on the skin and the eyes and the mucous membrane. And these are signs of jaundice. And then we have painful episodes which can occur when sickled red blood cells, which are stiff and inflexible, get stuck into the small blood vessels. Like I said, that they block the entry of the small blood vessels. So where they occlude, the person will always complain of pain. That is why you see, especially in children, that these children will complain of pain in the fingers and even in the toes and even in the joints, because at around that places there is very many branches of smaller blood vessels, and the sickle cells will occlude there and block the flow of blood to those areas. These episodes deprive tissues and organs of rich oxygen-rich blood, and this can lead to organ damage, especially in the lungs, in the kidneys, in the spleen, and brain. Particularly, serious complications of sickle cell disease is high blood pressure in the blood vessels that supply the lungs, and this condition is called pulmonary hypertension. So having got what happens in the body, that is the pathophysiology of the condition, let us look at the signs and symptoms. So signs and symptoms, we shall have progressive anemia, which is coming up due to the high rate of hemolysis, the breaking down of the red blood cells. So this person will progressively have anemia. Pain crisis, even in the chest, arms and legs, painful swelling of the fingers and toes, and priapism. This is due to blockage of the blood vessels of the sickle cell when they block the blood vessels. Then we also have acute chest syndrome, which is very life-threatening. The sickle cells stick together and they block the flow of oxygen in the tiny vessels in the lungs. So this person will present with a very painful chest, which is a life-threatening condition in sickle cells. Then we shall have hepatomegaly, which is enlargement of the liver. What does it mean? That the liver may need to work faster in order to clear the bilirubin, which is saturating. So in so doing so, the liver may become big. Splenomegaly, stroke can also come in, that the sickle cell die faster than the liver can filter them out. So this bilirubin, which causes a yellow color from these broken down cells, build up in the system, which cause jaundice. Then we may have heart enlargement, growth retardation, and maybe unhealing ulcers. So for the case of diagnosis, they shall take off a peripheral blood smear, and through the microscope, it will show a presence of a sickled shape, red cells. So after diagnosing, then we shall handle the management. And during management, let us look at the pre-conception care. Why? Because sickle cell is not coming in during pregnancy. This child has, because it is an inherited condition, it means this person was born with sickle cells, grew up with sickle cell, have reached adolescence with sickle cell, so this person may need to become pregnant. What do we do? They must do what we call preconceptional counseling, and this means that women with sickle cell anemia should receive counseling about the risks associated with the pregnancy. Genetic counseling should also be provided to discuss the potential for passing on sickle cell disease to the child. Of course, this child has lived with sickle cells, knows the pain, knows everything. I don't think this mother would like to deliver a baby with sickle cells. So, genetic counseling is very crucial, such that the parent or the husband to this girl who is sickle cell is not having any gene. Otherwise, if there is any gene present, it means chances of delivering another sickle cell baby are high. And then we shall advise them to frequent prenatal visits. Pregnant women with sickle cell anemia are considered high risk, so close monitoring is very essential. They may need more frequent prenatal visits to manage both obstetric and hematological complications.